Hello dear homeopaths, so today I am going to give you some of the glimpses of the Bowel nosode which you can use in your practice and you can get good result out of it. So the first Bowel nosode is Morgan bacillus. So now the key word for the Morgan bacillus is congestion. So whenever there is congestion in any part of the body, anywhere, you can use this bowel nosode, Morgan bacillus. It could be congestive headache like migraine. It could be dysmenorrhea. It could be congestion in the lungs in the form of the bronchial pneumonia. It could be on the skin. So whenever there is congestion, you can use this bowel nosode, and it has similar modality like lycopodium, that is 4 to 8 p.m. aggravation. Then the next is the bowel nosode proteus. So the keyword for the proteus is brainstorm. So let us understand what is brainstorm. Brainstorm is any kind of the sudden stress or sudden tension. And during this sudden stress, there are two types of behavior. We have learned that it is fight or flight response. So the patient could become either like chamomilla state, like very much irritable, contradiction, intolerance, or it may be ignatia like state. So for all this condition, whenever there is any sudden stress, you can think about this bowel nosode, proteus. Then the next bowel nosode is bacillus number 7. So it is called bacillus number 7 because it was the 7th bacilli observed in the laboratory by Patterson. Now, what is the keyword? The keyword for the bacillus number 7 is fatigue. Now, especially this fatigue, how it comes. So whenever there is overexertion, any kind of overexertion, and after there is slowness of the entire system. Let us understand by example that during examination, students read a lot, learn a lot, and after examination, they suddenly, they get fatigue. Or let's talking about the housewives, they work a lot just before Diwali. They just clean the house and does everything, household things, and then after Diwali, they just, they become, in fact, during Diwali onwards, they become so tired. After so much work, the person gets tired and ultimately results in the fatigue. You can think about this bowel nosode, bacillus number 7. Now, the next bowel nosode is dysentery compound. So, as the name suggests, dysentery, right? So, the keyword of this bowel nosode is anticipatory anxiety. So you must be, you must come to know by the name also that there are two homeopathic remedies to which we can compare this bowel nosode. One is argentum nitricum and another is gelsemium. So yes, it has argentum nitricum like anticipatory anxiety and gelsemium like diarrhea also from anticipation. So you can use this remedy whenever there is anticipatory anxiety. Patient become anxious before meeting, before examination, and in fact during traveling also. So this you can also give to the patient, who has to go to urination and for toilet very frequently during traveling. So for all this condition, you can give the dysentery compound. The next bowel nosode is psychotic compound. Now, as the name suggests, the psychotic, right? So this bowel nosode is very much related to the psychotic miasm. So it has got very similar modality to psychotic miasm and psychotic drugs like Tuja. So it has got very much aggravation during damp weather, or there is accumulation of the fluid anywhere in the body, and there is tendency to warts. So whenever you find any psychotic symptoms, and at that time you can use this bowel nosode as an intercurrent remedy, or you can also use this bowel nosode as the first prescription also as per the requirement of the case. The next important bowel nosode is Gartner-Betz. The keynote for the Gartner-Betz is malnourishment or malnutrition. So this malnutrition could be either after any kind of illnesses like tuberculosis or malignancy, or the one of the important indication is to the infants during the weaning period. So the weaning, if the child during the weaning period doesn't eat properly and become malnourished, so at that time you can use this bowel nosode. The next, last but not the least, bowel nosode is mutabile. So mutabile is the bowel nosode which is very much useful in today's era. Now you must be thinking that why it is important. All the bowel nosodes are important, but it's important is because of the causation. So it can be indicated whenever there is the constitution is damaged because of the stress, medication, and over treatment with symptomatic drugs, or poorly prescribed homeopathic remedies, or abuse of the laxatives. So these are the causes. If, and you know that these are the very important causes, right? So in during all this, whenever you find that any kind of such causes are there, you can think about this remedy. And it is very important to identify this remedy, because its constitution is very much similar to pulsatilla, mentally also and physically also. Like mentally, the patient is very much changeable and capricious, unstable, and physically there is alteration in the or changeability of the symptoms. So that's all about the bowel nosodes. So I hope you have got glimpses of the bowel nosodes and you will use these bowel nosodes in your practice. Thank you.